I'm a doctor, and if you are over 60, there are certain medications I would be very careful about. In fact, some I would strongly avoid unless absolutely necessary. Because here's the truth most people don't realize. What works for you at 30 or 40 can quietly become dangerous after 60. Your body changes, your metabolism slows down. Your liver and kidneys, the organs that process medications, don't work the same way anymore. And that means even common over the counter drugs can stay in your system longer, build up, and cause serious side effects. I've seen patients come in with confusion, dizziness, falls, even memory problems, not because of aging alone, but because of medications they thought were completely safe. So today, I'm going to walk you through some of the most important medications to be cautious with after 60, why they can be risky, and what safer alternatives you can consider. And please, don't stop anything suddenly without talking to your doctor. This is about awareness, not fear. Let's begin. First, let's talk about sleeping pills. Many people over 60 struggle with sleep. It's very common, and medications like sleeping pills, especially those that are sedative in nature, may seem like an easy solution. But here's the problem. These drugs can stay in your body longer as you age. That means you may wake up feeling groggy, confused, or unsteady, and that increases your risk of falls. Falls are one of the biggest health risks after 60. A simple fall can lead to fractures, hospitalization, and long-term complications. I've seen patients who started a sleep medication just to rest better and ended up dealing with serious injuries. Instead of relying heavily on sleeping pills, I often recommend focusing on sleep hygiene. Simple things like going to bed at the same time every night, avoiding screens before sleep, reducing caffeine in the evening, keeping your room cool and dark. These small changes can make a big difference. Now let's move to another common category, pain medications, specifically certain over-the-counter pain relievers. Medications like NSAIDs, often used for joint pain or headaches, can be risky after 60 if used regularly. Why? Because they can increase the risk of stomach bleeding, kidney problems, and even affect your blood pressure. And if you're already taking medications for heart conditions or blood pressure, the risks can multiply. I always tell my patients, occasional use may be okay for some people, but regular, long-term use without supervision can be harmful. Safer options may include physical therapy, gentle exercise like walking or yoga, heat therapy, or doctor-guided alternatives. Pain management after 60 should be more holistic, not just pill-based. Now, let's talk about something many people don't even think about, anticholinergic medications. These are found in many allergy medicines, cold medicines, and even some drugs for bladder control. The issue? They can affect your brain. Studies have shown that long-term use of these medications may be linked to memory problems, confusion, and even an increased risk of dementia. Yes, something as simple as an allergy pill taken regularly can impact your cognitive health over time. If you notice symptoms like forgetfulness, brain fog, or confusion, always review your medications. Sometimes the cause isn't aging, it's the medicine. Next, let's talk about anxiety medications. Certain medications used for anxiety, especially benzodiazepines, can be particularly risky in older adults. They may help you feel calm in the short term, but they can also cause drowsiness, poor balance, memory problems, and dependence over time. And again, increased risk of falls. For anxiety after 60, I often recommend non-drug approaches first. Deep breathing exercises, meditation, light physical activity, talking therapy. These approaches are safer and often more sustainable in the long run. Now, here's something very important, polypharmacy. This means taking multiple medications at the same time. Many people over 60 are on 5, 6, even 10 medications daily. And while each one may be necessary, together they can interact in unpredictable ways. side effects increase, drug interactions happen, and sometimes one medication is prescribed to treat the side effects of another. It becomes a cycle. That's why I always recommend a medication review at least once a year. Sit down with your doctor, go through every single medication, including supplements. Ask, do I still need this? Is there a lower dose? Is there a safer alternative? You might be surprised how much can be simplified. Now, let's shift slightly and talk about something positive. What should you focus on after 60? Because health isn't just about avoiding risks, it's about building strength. Let's start with food. Nutrition becomes incredibly important after 60. Your body needs more support, not less. Focus on high-protein foods like lentils, eggs, fish, chicken for maintaining muscle mass. Calcium-rich foods like milk, yogurt, leafy greens for bone health. Fiber from fruits, vegetables, whole grains to support digestion. And healthy fats like nuts, seeds, olive oil for brain and heart health. And don't forget hydration. Many older adults don't feel thirsty, but dehydration can lead to weakness, confusion, and even hospital visits. Drink water regularly, even if you don't feel thirsty. Now, let's talk about movement. You don't need intense workouts, but you do need consistency. Simple activities like walking daily, stretching, light strength exercises. These help maintain balance, muscle strength, and independence. Remember, movement is medicine, and unlike pills, it has almost no side effects. Now, one more thing I want to emphasize. Never self-medicate. Just because something is over the counter doesn't mean it's safe for you. And just because a friend is taking a medication doesn't mean it's right for your body. Your health is unique. Your treatment should be too. Always consult your doctor before starting anything new, even supplements. Because yes, even herbal supplements can interact with medications. Let me give you a real perspective. I've seen patients improve dramatically, not by adding more medications, but by removing the wrong ones. Less is often more after 60. So if you take one thing away from this video, let it be this. Be aware of what you're putting into your body. Ask questions, stay informed, and don't assume that common means safe, because after 60, your body deserves smarter care. If you found this helpful, share it with someone you care about, because this information can truly make a difference. Stay healthy, stay aware, and take care of yourself.